Okay, hi everybody, it's Basili, level 3 QHHT practitioner. Today I'm going to talk about sexually transmitted diseases. I know probably not the most joyous of subjects, but there is actually some really interesting information around that. Now, the people who have come to see me for sessions that have perhaps revealed that they are experiencing some kind of sexually transmitted disease. Let's go with herpes, because I think that one is a long-term, quite invasive, and one that does tend to stay around for a while. Now, what happens with the body? It's like it becomes like an environment of hostility in that area, in the sacral area. Now, generally, and I'm saying generally because I'm only going with the clients that come to see me, most of them, if not all of them, have had some sexual trauma in their life. Usually it's sexual violence or some kind of child sexual abuse. So the body at some point becomes an environment that needs protection. These people need protection. And they don't know how to protect themselves in some instances because of the trauma. So the body goes into like a defensive mechanism and a protection mechanism. So even though the herpes virus, for instance, may show up and you think this is a negative and it's a horrible situation for the person, in fact, what the body has done is provided a kind of armour to keep the person protected so that they're not likely to engage in a sexual activity, or in a way it's like wearing an armour. So it puts people off having sex and also puts maybe partners off sex. Now, obviously, it's not helpful to the person, especially if they're trying to recover and heal from the trauma, but they're not understanding that the body has just gone into a protective mechanism so that the person actually starts to look after themselves and not engage in maybe promiscuous behaviour or put themselves out there and they feel vulnerable. So it could be anything to do with that. So the body's actually protecting. So when we come for healing, the high self, if the person has obviously is dealing with the trauma, this is usually why they're coming for some kind of trauma therapy and some healing. So if that's actually happened and the person is ready to release this from their system. In other words, they're one, looking after themselves or willing to look after themselves. That's usually a condition. And two, to really put a lot of self-respect and protection and boundaries. It's a lot about boundaries. These people sometimes have unregulated boundaries. And that happens when people are traumatised and have had relationships that are not clear or have had some traumatic interference with abuse or sexual violence or some kind of violence. They're not able to self-regulate. So by learning to put in good boundaries, self-protection mechanisms, respecting self, protecting self, then the body can release this virus from the sacral area. And then it's done. So it's learning. It's about learning other ways rather than having to have this armour type of protection. Anyway, I hope that helps. It might help somebody understand that there's always another meaning and another insight into things that may seem fairly mundane or straightforward. Okay, lots of love. Talk to you again. Bye.